I voted for the Affordable Care Act. I appreciate that there's still work we have to do, but the fact is we now have over 11 million people in this country who have health care who would not have had it before the Affordable Care Act. The number of uninsured are down 1/3. The health care costs have actually stabilized, and we're seeing real returns in terms of savings to Medicare, for example. We've seen over $300 million in savings to Medicare this year. I think the Medicaid expansion program that was supported with bipartisan support in the state legislature has been a very big success. We had Harvard Pilgrim Healthcare in our office this week, and they were talking about the challenges of trying to set up health care for people in New Hampshire when they don't know what's going to happen, and what it meant for them to try and do that. And the important thing about the Affordable Care Act is that not only does it provide health care, it provides mental health care, and it also addresses substance abuse. So all of those concerns are covered under the Affordable Care Act. We've had almost 100,000 people who are now enrolled either through the exchange. I think the last numbers I saw were about 56,000 people enrolled in the exchange, and over 37,000 people enrolled in the Medicaid expansion program. It has reduced the cost of uncompensated care for our hospitals in a way that's been very successful, and I think it's been a huge success. Now, does that mean we're done and there's not more we have to do? No, we need to continue to improve. We need to continue to work out the bugs, but the fact is, it has made a huge difference for so many people. And, you know, if it goes away, as you point out, the businesses are going to be charged with a bill, people are going to be without care, we're going to see hospitals paying those additional costs. So I don't think that's the answer to deal with our healthcare challenge.
Well, first of all, I think that there are areas in particular that we're seeing a lot of challenges with the Affordable Care Act, whether it's work hour issues, 40-hour work week, where there certainly needs to be some changes made. And I actually think there are some bipartisan agreement on some of those changes, whether it's restoring the 40-hour work week, whether it's the medical device tax that has, has an impact on healthcare costs, and also areas where, unfortunately, that this is a great job area, Medtronic, other businesses in this area that are going to see a real challenge with this tax. And when it comes to my perspective on this, I would like to see more choice for individuals and make sure that we're really looking at the cost issue and more competition. And in addition to that, making sure that individuals at the state level can have more flexibility as to how they are implementing. There's so many mandates in this law that I think that it would be good to give people more flexibility and more choice. And while this is an area we disagree on in terms of, I wasn't in the Congress when the Affordable Care Act, but I've not been a supporter of it, I do think that there are areas where there are common agreement on some changes that need to be made to this law to address cost issues, competition, and choice issues.